Good morning everyone. I am Dr. Rekha Thote, a consultant gynecologist and obstetrician and colposcopist. I am going to tell about cervical cancer. The cervical cancer is the most leading cancer in India. Every 7 minutes, one Indian female die because of the cervical cancer. This is really very unfortunate condition in our country. Why? Because cervical cancer is a preventable cancer. We can 100% prevent this type of cancer if it is diagnosed early. Now, how can we diagnose a cervical cancer early? By doing Pap smear. Now, Pap smear is a test where we take the cells from the cervix and we see under microscope whether this cervical cells has any precancerous lesion or cancer cell. Now, if any woman with the Pap smear positive or diagnosed with pre-malignant condition or any cervical cancer cell is seen in the cervix, we can treat immediately and definitely not hysterectomy at that point of time if it is diagnosed little early. Certain condition when there is a Pap smear is not reliable or doesn't come positive, then definite method of diagnosing cervical cancer or a precancerous lesion is a colposcope. A colposcope is a magnified instrument where the cervix is visualized in a magnified view and we apply certain chemical on the cervix to diagnose if the cervix has any cancerous cell. If the cervix has cancerous cell, this chemical accepts through the cervical cell and it comes as a white patch on the cervix. So if there is any white patch after doing the colposcopy, then we can definitely say that there is a cancer cell in this cervix. This also can be treated without doing hysterectomy, that means without removing your uterus, and this is a boon. But unfortunately in our country, female doesn't come when they have no problems. This has to be picked up when there is no symptoms. So every 6 months, every woman should go to gynecologist and ask gynecologist to see cervix by eyes and see if there is any healthy cervix or unhealthy cervix. If it is healthy cervix, go ahead with the Pap smear. If it is unhealthy cervix, there are multiple tests to diagnose if this unhealthy cervix has any cancer cells in it. This is really very important because once cancer is developed in the cervix, it spreads very fast. The morbidity and mortality is very, very high once the cervical cancer is spread in the body. So I urge each and every woman who is listening my video that please do go to your gynecologist and please ask them to see your cervix and tell whether it is unhealthy or unhealthy, and ask them to do certain investigations to diagnose whether your cervix is going towards the cancer. Thank you very much.